Good afternoon. 12:15 sharp, we start. I'm based in Switzerland, and time is time. My name is Eric de Roodenbeke. I'm the CEO of IHF. What an evening we had yesterday. And after the show, I was reflecting on the competency for healthcare managers that we have been working on, and for which we had a great session that just ended. And I was saying, perhaps one was missing. We didn't put entertain and dance with energy. But from what I saw in the room, this competency is in your hands and feet. Bravo for ICRC and AHA to have organized this great evening for us. Yesterday, at lunchtime, you may have participated to the session where Emily Friedman, who is among us today, shared with emotion her presentation on hospital under attack. And she made a call to action. It is true that leaders cannot consider that this is not for them and this will never happen in their country. In IHF, we have decided to do something because we are part of the health community, but also for two other reasons that I want to share with you. The first one is that in all countries, we are witnessing more and more violence in hospitals. I'm talking about the kind of violence that you have, in the urban cities, the daily urban violence. They are growing all over the world. But in a hospital, this cannot be tolerated because our mission is to care each and everyone without threat when doing it. Emily presented a slide where a Syrian doctor raised his hand. I'm a doctor, not a soldier. For us, we have on our hands, we are health workers, not security staff. Behind this is all about the role of healthcare services in the society. If in democratic societies that are supposed to be in peace, there is no respect and hospitals are not a safe haven for healing, no wonder that when conflict happens, the kind of things that we are going to hear about is happening. Geneva Convention has been a progress for mankind after World War II. Let's not accept any regression on this. The second reason to get involved in responding to this situation is perhaps more from a managerial efficiency perspective. We are all facing more and more disasters, and for that, we need to be able to respond to them. The question is not for us, when will this happen? It will be, when will we have to face it? We therefore need to put in place all measures to prevent the consequences and to mitigate shocks of any disaster. This preparedness effort can be mainstream around similar approaches, and measures can be done to face this. And we are working on this with WHO. For both of these reasons, IHF has engaged on the side of the International Committee of the Red Cross that leads Healthcare in Danger project. Since 2014, we work closely and have contributed to the actions that ICRC has put in place to respond to this critical challenge. Yes, healthcare is in danger, and your contribution is important. By the way, for all those who are going to take the visit to the hospital, the little amount of money that we ask you is a token and symbolic way that we are going to express our commitment to the International Committee of the Red Cross. Let me call on the stage Dr. Bruce Eshaya-Chauvin, medical advisor to the Healthcare in Danger project from ICRC Geneva. Bruce, the floor is yours. Thank you.
Thank you very much. Thank you, Eric. Thank you for having us here in this important meeting. And thank you for all of you to stay and to listen to what I'd like to share with you today. So first of all, I need to find that. So the project Healthcare in Danger is a project that started in 2011 during the International Conference of the Red Cross and Red Crescent movement. You know, this is this big gathering happening in Geneva every 4 years, and the next one is in December this year. The task that was given to the ICRC was about improving the delivery and security of effective and impartial healthcare in conflict and other emergencies. So my first message here to you is to say that there is nothing new. There is nothing new about violence. Violence is probably at the basics, you know, at the roots of the ICRC. And it's because of this violence that the Geneva Conventions were launched. What is probably new, and this is, I think, an important message, is that for once, we don't look anymore at isolated incidents. Something happening in a hospital, something happening with nurses, doctors, pharmacists, midwives. We put this into one common basket in which governments have a big responsibility. So when we talk about healthcare, we talk about all of this. We talk about hospitals, clinic, first aid posts, ambulances. We talk about staff. And we have included also, of course, the military people. We are working very closely with the International Committee of Military Medicine, and I just want to say that they share a lot of their concerns with us, and we do the same with them. The basic question is very simple, and Eric said it already. Health should not be obstructed, abused, attacked. Wounded and sick have the right to health care. So this is probably very easy to say. You know, at this time of the day, I'd like to end this fantastic conference on a positive note, but of course, if I start talking about what's happening in the field or what Emily Friedman told us yesterday, we are going to be all very sad and very emotional. We need to keep, you know, something positive out of this meeting, and I hope this is what I would like to do with you today. What are we talking about? We are talking about what happens in conflict and emergencies. But maybe just to understand that if you look at explosions in a hospital, if you look at things happening, armed entry in hospitals, this is not only happening in conflicts. I'm sure that in this room, if we talk about gangs, people will understand that anything can happen anywhere, meaning that the recommendations coming out of this project, they don't have only a reality for ICRC and MSF in the field. They have a reality for all of us anywhere. We collect data. You know, we have to base what we do on data collection. But of course, collecting data in conflict has been always an issue. So I can't say that the data we collect are representative. But at least we have these data, and these data have been published by the ICRC, and they show what's happening in the field. So I just want, as a key message, to say that this quantitative approach has been completed by an excellent work done by MSF, having their project Medical Care on the Fire, and they went into a more qualitative perspective to explain violence in the field. And I think this is a very important component for you to take away is that quantitative data doesn't explain anything. You need also to have a qualitative approach. This is what we've been doing during the last 3 years. So here are all the issues that have been addressed. For each of them, we had 1 or 2 international workshops, and some of you have participated into these workshops. I'm thinking about WHO, PAHO, MSF, and IHF as well. Each of them, if you look at number 5, you have the publication over there. Each of them has produced a set of recommendations addressing the issue of military practice or ambulance and pre-hospital services. For each of them, we have tried to bring together recommendations and practical measures that concerns all of us. Of course, most of them are more specifically related to conflict and emergencies. But if we look at some of them, this is about safety of health facilities. I just want to draw your attention on the first one. When we were with Eric in Pretoria discussing about what shall we do to help people in hospitals in conflict areas to work, we suddenly realized that very often we pay a lot of attention of what happens inside a hospital, but we don't pay enough attention to the perimeter around the hospital. And we had colleagues from Iraq, we had colleagues from Somalia, we had colleagues that helped us to understand that it was key to prevent armed groups to get closer to the hospital. You know, we know that to try to prevent armed groups to enter a hospital is an impossible task, but at least you can slow down the process. And this discussion about perimeters, I think, is important also in different kind of countries in which you never know what can happen around the hospital, so it's probably better to anticipate. Number 8, non-state armed groups. You know, that was a usual discussion we had, especially with the first group, the military group. They were telling us, you know, nothing about us. Well, maybe they won't say that anymore. But the bad guys are the armed groups. We, as I was telling Emily before starting this session, the first victim of any conflict is the truth. So we don't know where it comes from. But we've been using the network of the ICRC that is used to talk to a set of armed groups to discuss with them also healthcare in danger. We have a publication on this. Of course, the publication is not going to quote this armed group or this one, but at least it's a very interesting perspective to see that some of them, they have exactly the same concerns and they are ready to collaborate on health issues. Remember, for those who know the WHO from my generation, you know, once they had a project called Health as a Bridge for Peace. Health is a good tool to bring people together. Much easier, in a way, to be honest, than the international humanitarian law, which is felt as this is for lawyers. If you put health in between, people start to feel concerned and also to find solutions. Yesterday, in her presentation, Emily was talking about, you know, sandbags and what we can do. Just want to say that within the recommendations that you will read through all the publications, some of them have been the source of passionate debates. The personal protective equipment, helmets, bulletproof jackets, and more. What can we recommend? Honestly, there is no good recommendation. Contexts have to be analyzed separately. You can't recommend for country A what will be applicable for country B. So there are issues. And one of them, besides the personal protective equipment, was about the GPS. You know, suddenly people thought that the use of GPS will probably protect hospitals or ambulances. We saw recently that, unfortunately, that was not the case. This is a picture taken in Iraq in 2004. Needless to say that no one survived. The question here is to say, what shall we do to make this impossible? So you will have a set of recommendations that will be attached to the ambulances themselves, some others that will be attached to what shall be the dialogue with the military, what should be the dialogue with the official authorities to make sure that this doesn't happen again. This is an OT. Obviously, you don't want your hospital to look like that, because if your hospital is looking like that, it means that the surgeons are working in very difficult conditions. So the paradox of this is that when the needs are very, very high, then it becomes terrible to work. So I've been in many conflicts around the world in the last 20 years, and I can tell you the frustration that our colleagues have because they can't work properly. Even if we have the human resources, it is sometimes very, very complicated. Eric said it. Preparing this session, we thought it will be useful to discuss about the peacetime. So this slide is coming from NHS, National Health Service. I got that in a conference in London. In London, where the number of incidents is very, very high. No, I'm not saying it's the highest or it's higher, just to say that this is the campaign they had to put in place. This is a slide coming from Paris to say that about 30% of the incidents are taking place in hospitals. This is another one coming from Australia. So Australia, they had to review their legal framework to combat violence against healthcare providers. And finally, this one is coming from Spain, where they also analyzed about 20 to 30% of the incidents taking place in hospitals. This is to say that the problem we have with healthcare in danger is not only limited to conflict. This is probably the best slide I have. This is the family we've put around healthcare in danger. So, of course, on purpose, I put the International Hospital Federation in the middle. But we've been discovering a lot of partners with whom we are working closely now. We started with MSF. We have to start with the people we are working with in the field. We've started also with the World Medical Association, and with both of them, we initiated this process of healthcare in danger. But this is now the whole family that is concerned by the problem. What we would like to ask you now is to go from this community of concern to a community of practice. We want you to have a look at the recommendations coming out of the project and implement them and tell us what is working, what can be improved, what has been efficient, what has to change. Some of the partners here, so I was last week in Düsseldorf for the International Pharmaceutical Federation annual meeting, in which I was also able to present the project. I just want to tell you that they have decided also to have a focus in the years to come on healthcare in danger, of course, but also the ethical dilemmas they face in the field. The International Federation of Medical Students has been also a key partner in the project and still very active. But of course, we know about the past. We know what happened. And we know that the world is able, how the world is able to produce disasters and more conflicts. The question is, how do we get prepared for that? If I want to get to the core of what I think healthcare in danger is about, I think it's about values. And the first one, of course, is about humanity. I think what brings us together is basically the principle of humanity. I'm sure that in this room, some people will tell me, well, I have examples of today that are not really full of humanity. And I know them. I've been working with the ICRC for many, many years. I know them. I witnessed them. But humanity remains at the core of the Geneva Conventions, remains at the core of healthcare in danger, and I hope it remains at the core of what we would like to do together. A word about impartiality and neutrality. If this part of the room is tribe A and this part of the room is tribe B, you don't like each other. You don't like each other. You don't feel neutral. Maybe you're healthcare providers, but you don't like tribe B or you don't like tribe A. The point is to say that the day you're going to have your white coat and you have to work, then you have to be impartial. And you know, we can't say that this is something that is obvious. I've been in a lot of contexts in which colleagues had difficulties to be impartial. If you look at, for instance, the health services of the army, they are also, in most of the places in which they work, they should receive also people from civilians around the hospital. But then they will tell you, how many beds do I keep for my troops? How do I manage when I have terrorists that have been wounded? A lot of these ethical questions with difficult response, but at least we need to base our work on the same values. Ethical principles. This came into the project from different perspectives. Ethical dilemmas, how do we manage with this? And what I've discovered, I'm not a specialist of ethics, but what I've discovered was that the doctors, they had their code, the nurses, they had their code, the pharmacists, and so on. So we decided, why don't we use this project to sit together and look at what is really what are the bases, the core of our ethical principles. And this document has been launched on the 30th of June this year. You can easily find that on the website of the Healthcare in Danger and also on the website of the authors. So we brought together the doctors, the nurses, the pharmacists, and the military. This is the first time that we have a common document between civilians and military. This is the first time we have a common document between nurses, doctors, and pharmacists. I'm sure that as hospital managers, you want to look at this document. You want to understand what is behind this document, and you want to contribute to his promotion. In one of the workshops we had, on the list, it was the one in Brussels. We brought together members of the IHL committees of 25 countries, and they have repeated again the question of the need to maintain confidentiality. I've heard in different presentations since Tuesday, I mean, talking about, even this morning we talk about the confidentiality of data. Let me tell you what this means in a conflict zone. In a conflict zone, a country that is normally sending statistics to the Ministry of Health about bullet injuries, for instance, continues to do that in the situations in which you have riots. And suddenly the reaction of the authorities is to send the police to the hospital, because the question of confidentiality is not anymore the main point. The main point is security. So they say, I'm sorry guys, but I don't care about your ethical principles. I want to know and arrest these people. So I think healthcare in danger is also an opportunity to improve the dialogue with governments on these issues. We have a wide set of publications, as I said, so I brought only one, the one on ensuring safety of hospitals, but you can find a lot more on our website. We also have an e-learning on responsibilities of health personnel, and this e-learning is really an opportunity for practitioners to understand what's their rights and responsibilities in different kinds of situations. What is applicable in a conflict? What is applicable when it's not a conflict, but a great level of humanitarian needs? That's the website. And to finish, I just want to give you this Goethe citation. I think we all know. The question is, how do we manage together to implement? And I just want to repeat my message here. What we want to do together is to promote a certain level of quality and impartiality in healthcare delivered. Thank you very much.
Thank you very much, Bruce. Perhaps as we are on schedule, if there is one burning question, we'll take it. We don't see with the light, but no burning question. That means you have convinced everybody, and I want everyone to give a big hand to Bruce for his presentation. And I do hope that when you all go back in your respective countries, you make sure to go and see on the website and look at the guidelines and tools that have been prepared, because there is a lot of resources, and nobody can say, I didn't know how to face, I didn't know how to be prepared. It's there, available, it's for you. As you may have seen all around and in the back of your program, the 14th World Hospital Congress will be hosting South Africa. So I would like to welcome the South African delegation. Please welcome Dr. Terence Carter, that is going to present us IHF Durban Congress. Terence, please come and join us.
So, as Eric said, the 40th World Hospital Congress will be held in Durban, South Africa. We have a short video to indicate to you why this would be a congress not to be missed. Can we please show the video? Thank you.
While Durban in South Africa has garnered a reputation as being a laid-back destination with an easygoing lifestyle, the country and city's renowned medical facilities make it the perfect setting for the International Hospital Federation's 40th World Hospital Congress in 2016. The South African Department of Health, Province of KwaZulu-Natal and City of Durban are proud to invite you to experience this prestigious global forum on its inaugural visit to African shores. This unique conference brings together key figures in the health sector to provide solutions geared towards the advancement of healthcare throughout the world. South Africa and KwaZulu-Natal are living laboratories where experiences from abroad are constantly being explored, adapted and applied. These processes in turn yield lessons for Africa and the world. South Africa is a middle-income country that bears a high and complex burden of disease. The high levels of communicable diseases and conditions that harm mothers and children, typically associated with poor countries, exist alongside disease profiles typically seen in the high-income countries of North America and Europe. This, together with the constitutional obligation to provide access to health services for all South Africans, has taken a heavy toll on the public health system, which caters for around 80% of the population. The public health system is currently in the midst of a transformation period to upgrade facilities and improve services ahead of the introduction of a national health insurance system that will hopefully see the public and private health systems working in synergy for the benefit of all South Africans. The hospital sector is an integral element in this process, and this first ever hosting of the World Hospital Congress on African soil will afford participants the opportunity to contribute and to learn from efforts to strengthen accountability and build a culture of innovation and excellence in this critical sector. South Africa, with its many significant medical milestones, has proven to be flourishing in the health sector. As the warmest place to be, Durban is the heartbeat of the country and Africa's leading conferencing destination, making the World Hospital Congress accessible and affordable to a wider range of delegates from across the continent. This commingling between delegates will ensure the opportunity to contribute to and learn from efforts to strengthen accountability and build a culture of innovation and excellence in this critical sector. While the Zulu Kingdom's world-class health facilities serve as the perfect platform for pre-Congress workshops. Key partners of this event include the National Convention Bureau and Durban KwaZulu-Natal Convention Bureau. These bureaus' missions are to aggressively identify and bid for rewarding meetings, exhibitions and incentive gatherings. The Durban KwaZulu-Natal Convention Bureau passionately promotes Durban's level of recognition and KwaZulu-Natal's business tourism venues and associated services. Durban ICC. The Durban ICC complex is Africa's largest award-winning integrated convention and exhibition center. This complex comprises 3 venues: the ICC Arena, the Durban Exhibition Center, and the world-class Albert Lutuli International Convention Center. This facility has been rated on 14 occasions as Africa's leading convention center and has also been rated as one of the top 20 convention centers in the world. Besides being home to the Durban ICC, the city also serves as South Africa's playground. Durban is a true place of Africa. A major port city in the South African province of KwaZulu-Natal, the Zulu Kingdom was voted as one of the new 7 wonder cities and named by the New York Times in its list of 52 places to visit in 2015. Durban is where East meets West to become the cultural melting pot of South Africa. A city which readily embraces its diversity, rejoices in its laid-back lifestyle, draws on its stunning environment, and seizes upon its business and technology prowess. What better location to showcase the significant strides made in the health sector than this picturesque backdrop of sun-kissed beaches and warm azure waters of the Indian Ocean? Not forgetting the towering peaks of the Drakensberg Mountains, untamed wilds of the Big 5 game reserves, and sensitive ecology of the isiMangaliso Wetland Park, among Durban's many exquisite attractions. Hosting the 2016 World Hospital Congress in Durban will ensure that a tradition of excellence and innovation in hospital management and planning is born and nurtured in Africa for current and future generations. Durban, KwaZulu-Natal and South Africa are confident and eagerly awaiting the opportunity to serve as a truly exceptional venue for this prestigious event. So book your trip to the #1 conferencing destination in Africa and add your knowledge and experience to this ambitious and multifaceted effort in transformation.
Thank you. the 40th World Hospital Congress in Durban, South Africa, not to be missed. South Africa has 3 consuls general in the United States, one in New York, one in LA, and one in Chicago. We are privileged to be joined to officially welcome you to Durban, South Africa, by our Consul General based in Chicago, Ms. Vuyiswa Tulelo. So on behalf of the President of South Africa, I invite to the stage to welcome you to South Africa, Ms. Vuyiswa Tulelo, our Consul General in Chicago. Thank you.
Thank you so much for that warm welcome. And of course, I couldn't have said it better than the video. Book your tickets today. Make sure you are in Durban next year, because that's the place to be. I thought just how best to put this invitation out. But I think the point that you concluded at, Bruce, makes perfect sense. It's not just enough to know. We must be willing to implement what we know. It's not just enough to be willing to have the good heart. We must put our willingness into action. My call to you today is be willing enough to put your money on the ticket and know enough to get on the plane ride to get to Durban, because I promise you, you will not regret that visit. And I want to assure you that the people of Durban will welcome you with open hearts, because as you can see, South Africa is a nation that is growing. But South Africa is also a nation where your expertise will be utilized to tell the future story of tomorrow. And with your partnership and your participation in the 14th International Hospital Federations Conference, you will be helping not to know, but to be able to implement the knowledge, and not to have a willing heart to change the world, but to act. Because what is this that we seek to do? Is it only to analyze the world or to transform it and change it drastically? I say, in pursuing that objective of transforming it drastically, Durban is the destination you want to head to. And thank you so much for giving me the opportunity to welcome you. And on behalf of the President of South Africa, we're looking forward to seeing you in Durban next year.
Now you are warm up, so you can continue and give a big hand to the South African delegation. And I didn't see you taking out your cell phone, because it's also where you put your calendar, and to mark up November 1st to 3rd to 16, Durban. Of course, take some days before and some days after, because as you have seen, there is a lot also to see there. Thank you so much. We are looking forward to go there. And I want to say that this presentation, the audio presentation, is great, and we'll be very happy to post it on our website to start the promotion. Now, we want also to acknowledge the contribution that for all those that have prepared posters. You know, we know that in conferences, often posters are little not acknowledged to the level they should be. Let me call Lawrence Lay, the special advisor from IHF in the Asia Pacific, who has chairs the Poster Award Committee. Lawrence, the floor is fully yours.
Dr. Eric Norman, President, Dr. Gwante Kim, immediate past President of IHF, Dr. Tom Dolan, Chairman of the Scientific Program Committee, and distinguished guests, delegates, and friends. On behalf of the member of the judging panel, Professor Guy Durand of Belgium, and Dr. Gerald Glendon from the States, I'm delighted and honored to be presenting the Poster Award at this special closing session. Before we hand out the Posters Awards, I would like to say a few words about the award and the judging process. As you may well know, the key goal of IHF is to improve the health of the communities through well-managed hospitals or healthcare organizations. To achieve this laudable goal, one of the strategies of IHF is to serve as a knowledge-sharing platform to promote best or evidence-based practice. This difficult task can be accomplished by authors and organizations submitting their abstracts and posters for sharing with peers their outstanding work and achievements in the IHF World Hospital Congress. IHF had launched the Poster Award for the first time in the last World Hospital Congress held in Oslo in 2013 to promote knowledge and experience sharing and to recognize healthcare organizations for sharing their significant achievements in areas such as service excellence, innovations, leadership and management, quality, and patient safety. This is the only second time that this prestigious award is to be presented today. IHF has also taken a very rigorous two-stage selection process to ensure that the award is given to truly deserving recipients. In the first stage, 4 expert abstract review panels were set up to select among the many submitted abstracts to be accepted for poster presentation. In the second stage, our panel is tasked to scrutinize all posters to determine the relative merits of each poster related to their content and organization, as well as the presentation of the authors on site. With such a rigorous selection process, I would like to take this opportunity to thank all the abstract review panel members once again, I think you are still here, for their outstanding work and contribution in selecting abstracts for poster presentation. For the second round of selection, I wish to offer our heartfelt thanks to Michelle of ACHE and Sheila of IHF for their excellent support. Without them, it would not have been possible for us to finish our judging so smoothly. Michelle and Sheila, please stand to be recognized. Please give them a big hand. Last but not least, I should also like to take this opportunity to congratulate all authors whose abstracts have been accepted for poster presentation. I can only say that even if you're not the eventual winners, you have already done extremely well to have gone so far. You will all receive a certificate of participation in recognition of your good work. Now it is time to announce the winners. Our panel has spent a lot of time and effort to review all the posters. In the end, we all agreed that 10 posters are particularly deserving and are really potential winners. And they are, please see the author's name on the screen. May we have the name of the authors on screen, please? Yes, so these are the potential winners. Now, in a moment, I will call upon the winners on stage. But before that, may I invite Dr. Tom Dolan to come on stage to present the award certificates. Tom, thank you. So out of the 10 outstanding posters, the judges had decided unanimously on the winner and the 2 runners-up. And now the winners. The second runners-up, Elisenda Sanz from Spain. Please come on stage to receive the award. So her title is Decreasing of Interference and Time Spent on Transference of Information in Changing Nurse Shifts. Congratulations. The first runners-up, that is a second place, goes to Eric Ho from Hong Kong. Eric, please come on stage to receive your award. Her poster is Improvement Initiative of Resuscitation Service in a Regional Rehabilitation Hospital in Hong Kong. Congratulations. And now, the winner of the poster award goes to There's no drum roll. Dr. Sapan Disso from the United States. Dr. Sapan, congratulations. Please come on stage to receive the winner award. Congratulations. Maybe let's do a group photo on this side, Tom. Actually, besides the award, Dr. Sapan will be given a free registration to attend the 40th World Hospital Congress to be held in Durban in November 2016. So he's the first to buy the ticket to go to Durban. The winner and the two runners-up have also won the opportunity to publish their posters in the forthcoming IHF Quarterly Journal. Before ending, if you are interested to win the poster award in the next IHF 40th World Hospital Congress to be held in Durban, please look out for the announcement and submit your abstract early. Now that ends the poster award presentation. Please congratulate the poster winners and in fact all the poster presenters by giving them a big hand once more. Thank you.
Thank you very much, Lawrence, and please also congratulate by giving a big hand to Lawrence, Guy, and Jerry that have really worked hard to make this happen, and I know how big a work it is. Now, it's the moment where feelings get mixed because we are coming to the end, so we have to share at the same time sadness and joy. Sadness because it's no fun after having spent so much time and energy together and created this feeling of companionship that we have to shake hands and say goodbye. But we know we'll meet each other again in 1 year in Durban. So it's time to live. Joy because I think this Congress has brought us a lot. During the gala dinner, we had already a number of congratulations, but I believe that all that contributed to the Congress deserves some more congratulations. And I really want to share these congratulations to express joy by doing this. This Congress was remarkably well organized by a host, the American Hospital Association and the American College of Healthcare Executives, supported by the organizing committee. Please join me in expressing our appreciations for their hard and highly successful work. Can you stand up, those who are from the committees, if they are around, so that we can clap and thank you, really. From the IHF side on the Secretariat, I would specifically want to recognize 4 persons. We have been on your back, and you had to bear with us. So we need to recognize clearly how much you have done and how much you have been keen with us. Let me ask them to stand so that we can express our appreciation. Megan Angelini, Sarah Lane. Megan, Sarah Lane, if she's around. Alec Rosowski. Where is Alec? Here, Alec. And Sonia Hernandez. They have been working hard and very hard. And if you know me, it's hard to work with me. I'm very demanding. I also believe that an excellent scientific program was put together under the leadership of Tom Dolan. This program is now reflecting a stage of maturity, and it sets an example for our coming IHF congresses. We had really inspirational keynote speakers that have talked to us on highly relevant topics. We had a number of sessions led by IHF members from around the world that allow to share experiences and accomplishments on topics that matters for all of us. We had specific sessions where leaders from different parts of the world got together to talk on specific topics like rural hospital or big data. We had also sessions presenting the work by IHF under their special interest groups, and some that were put together by partners that we have or premium associate members. Their experience and knowledge have been important. Last but not least, we had an opportunity for academics and professionals to search their research and experiences through oral presentation and posters. Definitely, IHF Congress is a solid knowledge exchange event when everyone can pick and choose what is of interest. Let me ask scientific committee members to stand so that we can recognize them for their accomplishment. But all this was made possible because we had hosts, and I want to conclude by asking that you make a standing ovation for Tom Dolan, Rhys Understock, and Deborah Bowen. Please stand to recognize that all three of them and their teams behind them have done a tremendous work making this Congress a great and successful event. Before I give the floor to Eric Norman, that is going to conclude as IHF President and close the 39th Congress, let's, as a CEO, I have to do some housekeeping announcement. Let's not forget, for those who are registered for the hospital visit, that buses will depart at 2 sharp, so you have to be at the lobby of the Hyatt at 1:45 so that you can be directed to the right bus. For those after the visit, you are most welcome to join the reception that will be in Crystal Ballroom at 6 p.m. It's in the other tower on the ground floor. Those who are not visiting the hospitals are welcome also to go at the same location to go to the Innovation Forum. Thank you so much, and Eric, you have the floor to do the final closing. It's all yours.
Thank you, Eric, and thank you all for 3 wonderful days. As we have heard in both the plenary sessions and in the parallel sessions, there are a lot of nice work done and there are a lot of work to do. I think we have challenges and there are work to do for all of us for many years. But I won't summarize more than this. I would like to congratulate the organizing committee, Tom, Deborah, and Rick, by having this wonderful conference. And please give our regards back to your organizations and thank them, and one big hand again. I'm really looking forward to the next meeting in Durban. I have already marked my calendar, Eric, so the 1st to the 3rd November 2016 is already blocked, and I will have some days in advance and some day after. So I already talked with a travel agent, and I will spend more time in South Africa to see the wonderful country. So I'm really looking forward to that, to the 40th World Hospital Congress. As a symbol, I will take off my badge now, because we are coming to the end. And I was also going to, yeah, there you are, Deborah. Please, come. You deserve the IHF's definitely biggest hug, and by this I close this Congress. Thank you. Have a safe trip home, everyone. Bye-bye.
The same old blues coming round again. Every night about this time, and it's calling me like a long lost friend when I turn out my lights. Now I can see you in my dreams every time I close